Phones lit up when actress Angelina Jolie revealed her positive genetic test for a breast cancer gene drove her decision to have a mastectomy. Patients have been calling to demand genetic testing, so we looked into this cutting-edge approach to fighting back against cancer.
Checkups at the doctor's office often include screenings for cancer, things like skin, prostate, or breast cancer. Knowing your family history helps doctors better screen for and diagnose cancer.
You'll be surprised how many patients do not know their family history.
Dr. Regina Lewis, director of the OSU Family Medicine Women's Health Clinic, says doctors find early cancer detection is often about 10% symptoms and 90% family history. Women with a BRCA1 or 2 gene mutation are 5 times more likely to develop breast cancer than the general population. 12 years ago, Liz Williams was diagnosed with breast cancer.
All during my treatment, I kept asking the doctors, I'm really worried about my granddaughter. Her other grandmother died of breast cancer. Oh, it's okay. How old was she? And I said, well, she died at 54. Well, she was over 50 and you were over 50, so don't worry about it. You know, she's okay. It's not going to happen to her.
But it did. 4 years later, Williams' daughter Karen Howerton and her granddaughter Kara Beeler were diagnosed with breast cancer. Now Kara worries that her daughter Kelsey may get breast cancer as well.
My grandmother had her cancer in her 60s. My mother was in her late 40s. I was in my 30s.
That prompted Beeler's doctor to order genetic testing to see if the women have a rare gene mutation known for increasing the risk of certain cancers. They do. The BRCA2 gene. While the number of women with the cancer genes are small, BRCA1 and 2 gene mutations account for 5 to 10% of breast cancers and 10 to 15% of ovarian cancers among white women in the United States. That's according to the National Cancer Institute. Having a BRCA1 mutation also increases a woman's risk of developing cervical, uterine, pancreatic, and colon cancer, while the BRCA2 mutations increase the risk of pancreatic, stomach, gallbladder, bile duct cancer, and melanoma. Men with BRCA1 have an increased risk of breast and possibly pancreatic cancer. Those with the BRCA2 mutation have a higher risk of testicular, breast, pancreatic, and prostate cancer. Having one of the gene mutations doesn't automatically mean cancer will develop or that it will happen earlier in life. But women with the BRCA1 and 2 genes do have a 50-50 chance of passing it on to their children. That sparked concern in Beeler's 19-year-old daughter, Kelsey.
I had a really strong feeling that I was going to be the one that tested positive, and seeing the other 3 in my family have it, I just thought for good measure it would be good to be tested for. And they say breast cancer comes a decade early every generation. And it would put me in my 20s if I had it.
Even so, her doctors were reluctant to order genetic testing.
I had to ask them and basically beg them to test me.
Why the reluctance?
Age.
Yeah, my age.
And what she might do if she was positive. Yeah. So they're afraid that these young girls are going to do these heroic things or that they may regret later on in life.
Like having a mastectomy or hysterectomy, which only lessens the chance of developing cancer. The results of Kelsey's genetic testing and what she'll do because of it are featured in the July 16th edition of Girls Life magazine.
One of the headlines were the boob debate. What am I going to do about my boobs?
Kelsey Beeler did the article to let teens and young women know, depending on family history, breast cancer screening isn't just for women over 40. Kelsey discovered she has the BRCA2 gene just 2 months after learning her mother's breast cancer was back. This time, it had spread to other parts of her body.
I have it in the fluid around my heart. I have it in my lungs, my lymph nodes. I have it in certain parts of my bone.
The re-diagnosis was devastating.
I just cried and was hysterical. I thought I was going to die. So, yeah.
Now on a newly approved chemo drug that doesn't make her hair fall out, she's much more optimistic.
At this point, they're telling me that it's not curable, it's just treatable. So we'll see.
Kelsey says seeing how breast cancer affects her family helps her weigh options. But Dr. Lewis says genetic testing isn't for everyone.
Usually, they want the person who has breast cancer to be tested for the gene first. Then, for the other females in the family, if that test came back positive, then they would need to be tested for the gene.
Lewis says since stories about Angelina Jolie's genetic testing to determine her cancer risk started appearing in the media, more patients are demanding genetic tests for themselves.
We really do not recommend everyone to come into their physician's office saying, I just want to get tested for, all cancers, which has happened.
For those who don't have a history or symptoms, there's a new imaging clinic in Oklahoma City that offers what some call private pay for peace of mind screening. Advanced Body Scan offers MRI and low-dose CT scanning to detect abnormalities inside the body.
We can find abnormalities about the size of a grain of rice.
Larry Trucano is the clinic's managing director. He says if something is found, the patient can then go to their doctor for further testing. But Dr. Lewis still suggests when families get together, they talk about their medical history.
Anytime you get with family, it's very important to start asking those questions. Is there who had what?
That lets medical providers know if you need cancer screening according to guidelines for the general population, or if you have risk factors that require earlier or more thorough testing.
Yeah.